Hello, everyone. Let's go ahead and get started. I am so excited to see everyone here today for our Advancing Organizational Health Literacy webinar. Here is our agenda for the day. First, I will give an overview of our health literacy initiative. Then at 12:20, Melanie Sampson from Literacy Works will talk to us about who can do this work. At 12:28, I will give an overview of our new toolkit and web hub. Melanie will follow with an example of how you might navigate the toolkit. We hope to have some time at the end for Q&A, and then we'll make sure we wrap up by 1 o'clock. But let's start first with some introductions. I'm going to pass it to my colleague, Melanie Sampson, to introduce herself.
Hi, everyone. Thanks so much for being here, and thank you, CCDPH, for having me. I'm Melanie Sampson. I'm the program director of the Clear Language Lab. This is a program from Literacy Works, a Chicago-based nonprofit. My background is in adult education, and that really informs my role of what I'm talking about here today of plain language and organizational literacy and helping people navigate systems. So in our work at the Clear Language Lab, we work with all sorts of mission-driven and nonprofit government organizations that just want to make everyday content that people can easily navigate, understand, and use. So that is what we do. And we've been working with the Cook County Department of Public Health for the last year and a half. And I'm really excited to share about our journey through this presentation.
Thank you so much, Melanie. And I am Darcy Moeller. I'm a public health physician and artist, and I serve as one of the medical directors of the Cook County Department of Public Health. I lead our health literacy initiative here. I'm also associate program director for the Cook County Health Preventive Medicine Residency Program, and I see patients at the Core Center in the Sexual Health and Prep Clinic. Lastly, I do some teaching at Northwestern, where I'm designing a new course on health literacy for the MPH students. All right, let's dive in. So we're going to start with an overview of the Health Literacy Initiative, what it is and why it matters to us at Cook County Department of Public Health. When many people hear the term health literacy, they tend to think about individual skills, like knowing what questions to ask at a doctor's appointment and being able to read and understand medical information. These examples these are examples of what we call personal health literacy. In 2020, the U.S. Department of Health and Human Services updated its definition for Healthy People 2030. They defined personal health literacy as the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Alongside the Healthy People 2030 update to that definition, HHS also formally defined organizational health literacy, which was a big step forward for advocates of this work. Organizational health literacy is the degree to which organizations equitably enable individuals to engage in their health decisions. So while personal health literacy is about what individuals are able to do, organizational health literacy focuses on what we as organizations are doing to make health information and services truly accessible. Personal health literacy matters, but it is specific to the context we find ourselves in. How health literate someone may be personally and their ability to act on their knowledge is intrinsically influenced by the systems around them. And that's what today's webinar and our toolkit is all about, looking at how organizations are set up to support health literacy in a way that's effective and equitable. Before we go any further, I keep using the word equitable, so I want to take a moment to talk about health equity because it's at the heart of why we're doing this work. Dr. Kamara Jones defines health equity as the assurance of the conditions for optimal health for all people. Achieving health equity requires valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. So health equity isn't just about fairness, it's about creating the systems and conditions that allow everyone to thrive. And that's where organizational health literacy comes in. When we focus on organizational health literacy, we're not just improving communication, we're removing barriers to health. In this way, improving organizational health literacy directly contributes to reducing health disparities. It's a fundamental strategy for achieving health equity because it ensures that all individuals have the same opportunity to make informed decisions and take control of their health, regardless of the challenges they face. I won't read through this whole slide, but I did want to mention CDPH's mission and vision. At the Cook County Department of Public Health, health equity isn't just a goal, it's really part of our DNA. Our vision speaks to the idea that everyone in suburban Cook County should have the opportunity to reach their full health potential, no matter who they are, where they're from, or where they live. And our mission reflects that same commitment to optimize health and achieve health equity. This commitment is exactly what led to the creation of our health literacy initiative. The purpose of this initiative is to increase health equity in suburban Cook County through public health system transformation with health literacy as a guiding principle. So let's take a closer look at how we can act on both personal and organizational health literacy. On the personal side, health literacy is about increasing people's knowledge and abilities so they can make the best choices for themselves, their families, and their communities. On the organizational health literacy side, it's about decreasing the complexity of systems, making them easier to navigate. So, for example, a healthcare provider might say, I can define these medical terms for you so you could recognize them next time. That's definitely helpful, but what if they don't understand or don't remember? Studies show that it's actually very likely that they won't tell you they don't understand. Instead, we could use everyday plain language every time we interact so people don't need to remember the medical terms. Another example of relying on personal health literacy is helping people access resources that they need by increasing their knowledge of services. So you might say, I'll give you the address for a food bank to help you with groceries. And while this is helpful, it still doesn't account for what personal or system limitations or barriers that individual might have. An organization can make it easier by connecting them with someone who can help them navigate the system, someone like a community health worker, for example. Um, so this isn't just about directing people to help, it's about providing the support to help them get where they need to go with minimal barriers. Our ultimate goal is for better health outcomes for everyone. But here's the thing, when we talk about a health literate public health system, we're not just talking about organizations individually improving their health literacy. What we really need is for all these organizations to work together to create a health literate system as a whole. A health literate public health system is one that makes it easier for everyone, regardless of race, gender, sexuality, socioeconomic status, or personal health literacy skills, to access and understand the services they need to achieve their best health. At their core, our public health and healthcare systems are supposed to serve people, but too often we see systems that are built around other priorities, things like billing codes, insurance requirements, organizational profits, not around the people they're meant to serve. And let's be honest, most of us have experienced the frustration of navigating these systems and struggling to get the care support we need, whether it's getting a simple question answered or trying to understand how to access a service. These systems can be overwhelming and confusing. The most effective and equitable approach isn't about asking individuals to decode these complex systems. It's about simplifying the systems themselves. This graphic shows the three levels of health literacy: personal, organizational, and system-wide. To achieve our vision of better health outcomes, we ultimately need to address all three levels, but the higher up we work, the more impactful. I'd also like to call your attention to these cyclical arrows between the levels. This shows that health literacy at each level interacts with and influences the others. A strong system, for example, supports organizations, but is also built by organizations. And health literate organizations help individuals to thrive. So CCDPH wants to support the folks working in public health, government, social services, healthcare, other relevant fields to engage in this work. So to help do that, we're excited to introduce two resources we have developed to support organizations on their health literacy journey. On April 9th, 2025, we launched the Advancing Organizational Health Literacy Toolkit and healthliteratecookcounty.org, our new online hub. We'll give an overview of these resources, but first I want to pass it to Melanie to talk a little bit about who might want to engage in this work.
Thanks, Darcy. I'll lead with the hint, everyone. This was for those of us, for folks that we've worked with before, the first question they hear us often ask is, who is your audience? And that was definitely part of our initial conversations and our conversations throughout as we were working on this project, because we wanted to make sure that this project was inclusive and was available to all the right people. And we realized that all the right people is very expansive. So that definitely played a big part in how we fleshed this out. So I'm just going to talk a little bit about some of the factors that we considered. Next slide, Darcy. So the first one we thought about was sectors. I think one of the as someone who's worked in community-based settings, I had never thought about myself working in public health. But the reality was, as an adult education administrator, I was constantly connecting people to domestic violence services, healthcare, housing, help getting the bed bugs out of their house, like all sorts of things like that, so that they could attend school and thrive and get what they needed from our community. So we wanted to really be thinking about how can the toolkit be expansive and thinking about all these different roles that, may consider themselves part of the public health community, but also roles that are maybe adjacent or that are more loosely connected, but really all affect social determinants of health and how well communities can thrive. So we really wanted to make sure that the examples we talked about and just the different components could resonate with these different types of groups. Okay, next. And then thinking about organizations, we wanted to recognize that there are organizations of all different shapes and sizes and locations that exist even within our region. Suburban Cook County has villages and bigger communities. It's adjacent to Chicago. All these different size organizations have different structures and different leadership styles, models, and also there's a tendency toward siloing. I think that's been my experience. I imagine many of you have experienced that. I think that comes from a lot of people just working with their head down, trying to get their jobs done, and it leads to sort of missed opportunities of making these kinds of powerful connections. So we really wanted to be, as Darcy said, thinking about not just one specific type of organization, but being flexible in types of organizations, and then also recognizing how they work together. And then roles. This one was tricky because we recognized that folks that may have specific roles that sort of label them as leaders in an organization, those roles are really important in getting a lot of things done at the systems level. But recognizing that leadership looks a lot of different ways and that it might not be about job title and that people in all different roles in an organization have a role to play. So I think we really wanted to make sure that the people on the ground who are, doing this work out in the community and have so much knowledge and things that they can share about their experiences and how the work works, that they had opportunities to be involved in this process, as well as those folks that maybe have just more administrative roles, but can see the big picture and just recognize that all these different hats people wear, they're all needed in this process. Okay, and last one, incapacity. So this definitely came up. We had an early iteration of the toolkit where we piloted with some of the folks across the community last year. And one challenge was capacity. A big challenge is capacity, right? People are very busy. So we wanted to really dive into the idea of making this very useful and practical and accessible for a wide range of capacity. So not requiring that this is the only way to do things, but really trying to be flexible and helping people find the things that can work for them to help support them as they create change. And we also wanted to model. We talk a lot about ways to deliver information, and we wanted to model that. So we wanted to make sure it felt helpful, it felt scaffolded, it felt engaging, it felt flexible, that people could come to this with feeling excited and with a strength-based approach, not a deficit of what we're not doing, but what could we be doing? So these are all different kinds of factors that we had to consider as we were kind of putting this all together. And I'll pass it back to Darcy.
Thanks so much, Melanie. All right, so next we're going to jump into a little bit more of an overview of the toolkit and the Web Hub so you can see some of the details. So the Advancing Organizational Health Literacy Toolkit is almost 90 pages of information and resources. It's not meant to be comprehensive. It's rather meant to provide actionable steps and practical tools to get started with the work. There's so many different ways. I mean, as Melanie was talking about with the different roles and different type of organizations, there's also so many different ways that you can approach this work. And so there's really something in here for everyone. Before we dive deeper into the toolkit itself, I want to take a moment to recognize and thank our partner organizations whose staff contributed to this work. The logos you see here represent 16 different organizations, community-based groups, academic institutions, healthcare organizations, public health departments, and more. Throughout the development process, over 50 people offered valuable feedback, shared their insights, and really helped to shape the toolkit into a practical and grounded resource. Some folks even contributed stories that are featured in the toolkit, showing real-life examples of health literacy in action. I would like to especially thank Literacy Works for their authorship of much of the toolkit and for their close partnership and collaboration throughout this entire process. Their expertise and commitment to this work is really inspirational. So it's been a great partnership. Okay, so here's a glimpse at some of the introductory content of the toolkit. This lays some of the foundation that I already presented to you. It defines health literacy and health equity, and then explores a little bit about how those two things are connected. It discusses the role of structural and social determinants of health. And then it also includes a timeline for those who are interested that shows the story of how this toolkit came to life. These pages, 15, 16, and 17 in the toolkit, they lay out the purpose and vision of the Health Literacy Initiative, and they also introduce the framework that we developed to determine the activities we recommend engaging in. So I do want to take a few minutes to walk you through a part of this framework, which can be a little complicated, but I've tried to simplify it as best I can so that you can understand sort of why we got to what we're recommending. So this is a really simplified graphic of what you might call a theory of change. Some people call it a logic model. Some people use those terms interchangeably, sometimes use them differently. We've been calling it our theory of change. So this is likely a new concept for some people on the call, and I'm not going to spend too much time on it, but just the key idea is that a theory of change helps you to think strategically about how you will achieve your goals. So it maps out your resources and constraints, so what you're working with on the left side there. Then it outlines the activities that you plan to do. And then finally, the outcomes that you hope to see as a result of those activities. I actually prefer to develop a theory of change backwards, starting with the outcomes that we want to achieve. So that's what we did. So to be as broad as possible, we developed what we call our aspirational outcomes. So the outcomes that we would expect to see if our full vision was achieved. And these outcomes have served as our guiding star. They help shape and align all of our efforts moving forward. So not just the toolkit and the web hub, but all of the other work that we're doing related to health literacy. I'm bringing this graphic back now because it helps illustrate how our aspirational outcomes are structured. Um, just like this upside down pyramid, our outcomes are organized across the three key levels of health literacy. So we start at the top of the framework with the systems level. Our first aspirational outcome speaks to the broader public health system here in Cook County. Our vision is that the Cook County public health system works collaboratively to improve governmental, healthcare, and social service systems to make them more navigable to priority communities. Um, this is about systems aligning across sectors, public health, healthcare, social services, to reduce the complexity and to better serve the people who rely on them the most. At the organizational level, our vision is that all organizations in the Cook County Public Health System understand and can clearly explain the importance of health literacy and the connection to health equity, and are integrating health literacy best practices into their daily operations. And then the remainder of the aspirational outcomes sit at the interface between organizations and individuals. So they're really centered around how organizations can equitably enable people to find, understand, and use information and services. And rather than reading through all of them, they're in the toolkit if you're interested. I'll just quickly summarize the key ideas here. Finding information services means making sure people have easy access to the health and social services they need, no matter how they enter the system. It's about comprehensive outreach and ensuring that information is available in the spaces that are most frequented by priority communities, whether those are physical or digital spaces. Understanding information focuses on making sure that public health information is accessible, using appropriate languages and cultural context. And using information and services is about supporting residents to take action on their health, whether that means engaging with healthcare, making lifestyle changes, or advocating for themselves and others. The system needs to empower people to make informed decisions to take control of their health. So, as you might be thinking, there are really countless ways that organizations can work towards these aspirational outcomes. Um, a few examples might be staff training, revising materials, improving accessibility, so many different things. So, to help organize the material, we've sorted the activities into different categories based on common themes. And we call these categories our focus areas. And there are six of them: leadership and organizational transformation, health literate workforce development, partnerships and intersectoral collaboration, accessibility of information and services, communication practices and standards, community engagement, and outreach. And the page numbers listed on the right there correspond to where you would find that section in the toolkit. This structure really is to help organizations choose their own adventure and focus on what matters most to them. These are the title pages for each of the six focus area sections in the toolkit. Each section is really designed to provide practical guidance and resources to improve health literacy in that specific area. Melanie is going to give us a tour, like an example tour of one of these sections in a moment. But in the meantime, I do just want to quickly show some screenshots of our web hub as well. So this is a screenshot of our web hub, which is embedded in our Cook County Department of Public Health website, but you can also find it by going to healthliteratecookcounty.org. The site is a space for sharing more resources, updates on our work. We plan to be adding future things in the future. We also have another toolkit that's in development, and then additional tools to support your health literacy efforts. This is the same page, but if you scroll down a little bit, and I just wanted to point out that as you can see on the right side of the screen, there's a menu that allows you to easily navigate to each of the 6 focus areas. This makes it really simple to just jump into the section that's most relevant to your needs, especially if you're working in the toolkit and you're looking at a certain section. Like I said, the toolkit's pretty high level, and you might say, I really want to learn a lot more about this. So coming to the hub, you'd be able to find a lot more information about those specific activities that we have in the toolkit. I also want to call your attention to our assessment tool. You can click on Complete the Assessment tool to download our Organizational Health Literacy Assessment. The Organizational Health Literacy Assessment is a companion to the toolkit. This can help you evaluate your organization's current health literacy practices and identify areas for improvement. You can use the assessment in a couple different ways. You can start by going to just a specific focus area that you're really interested in, and try that, or you can go through all 6 focus area assessments and decide which areas to prioritize based on kind of the discussion that might follow after your organization goes through this. It's really flexible, and it's a good option for anyone who just really doesn't know where to start. Now, so let me pass it back to Melanie, and she's going to walk us through one of the focus areas.
Thank you. And I just want to say, I see a couple of folks have added some things to the Q&A. Thank you so much. Please feel free to add any other thoughts in there if you would like, and we will try to address those things very soon. We're going to talk just about one example focus area and dive into. So this is focus area 4, which is about the accessibility of information and services. So one thing we talk about in the toolkit is thinking about accessibility widely. So not just narrowing it down to maybe what the legal definition of accessibility is, although that's very important, those kinds of legal supports, but also just thinking, again, I keep using that word expansively, but thinking about it, in the widest way possible of, what are the different ways that people might be impeded from using our services, or following directions or getting access to something they need, and what can we do to break down some of those barriers and walls. So we're just going to take a little walk through this section just to give you a snapshot. So as you can see, the beginning of each section, we've got the cover page, and then we've got these 5 key areas that we decided to focus on. Again, as Darcy said, this isn't exhaustive, but these were things that we definitely recognized come up. I can speak to the fact that, like, having worked in this adult ed, human services sector for pretty much my entire professional life, that these are things that I have seen over and over again, and these are things that we sort of culled from those groups that we've been working with and things that we observed, that where we saw opportunities to kind of raise up and highlight. And then there's a little table of contents there where you can see, if you just want to zone in on one specific thing, you can easily get to that. And then next slide. Yeah, and then these are the content pages that go a little deeper. So this is where we look at some practical applications and thinking about what are some areas that maybe we can refresh on, or what are some areas that might be really important but are brand new to us. Again, we wanted to think about the different roles that people have, and that even if there's a topic here you already know about, thinking about, well, have I been applying it? Is there places for me to go deeper, or are there places for me to just work on sharing the knowledge I have with other people in my world, whether that's my team or my department or community members. So really kind of emphasizing the idea of lifelong learning for all of us, and how we might share that information. So again, this isn't exhaustive, but it's hopefully either a jumping off point or an opportunity to revisit something that's really critical to this work. And next slide. So here's one example. This is talking about a process and thinking about how we can think about challenges with processes in ways that are strength-based. I think, some of this work we're talking about are is a really big culture shift in the sense of thinking about, kind of challenges as opportunities to improve or reflect on, as opposed to just something that's not working. So this is one example, and you can see there's kind of some directions or supports at the top of the page, and at the bottom we have a practice example of a real life situation where things just aren't going right. What are some ways we can, in a really practical way, make these processes work better for people? And part of that involves creating an environment where people can try things, and people might make mistakes, and how do we cultivate that in our work? And then another really key thing that we were really excited about was really just getting local and telling stories. So there's also examples in each focus area about the work happening in Cook County. So we wanted to highlight some things happening at the Cook County Department of Health that align with the things that we're talking about here. So the example on the left showcases some things that are happening in Cook County, and as well as just we kind of pulled out some things from the strategic plan there, just to highlight how integral these ideas are in everyday work. And then we wanted to tell the stories from local partners. So you can see we have an example there. That's Danisha. She is one of the 6 people that told us their stories about how they are integrating these ideas into their work and how it has supported their colleagues and community members in better health outcomes. So that was, I think, a really key piece of this for us, is really wanting to celebrate and raise up the successes that are already happening, because we know that a lot of work is already being done, and we want to just raise that up more and learn from each other and inspire each other, especially when things are hard. So we wanted to kind of have that as a really key piece of this too. So, and then Darcy mentioned, if you go to healthliteratecookcounty.org, you will find the web hub with all of this stuff in it. So we've got some resources on the website. So if you look over on the left, we've got links to the toolkit and the assessment tool on each page. So if you don't want to go back and find it, it's there. We've also got activities and worksheets. We'll be growing this, so definitely please feel free to come back and check it out over time. And you can download some of the ones that are already there. And then we've also got a curated set of resources. So that was really important. We wanted to make sure that we were, giving opportunities to expand more. So if some of these things are things you're really excited about, we wanted to share resources that have come up in our work. Okay, next slide. So you can see if you're really interested in zoning in on a certain focus area, we've got these links on the side. And you can zone in and go back and forth between these different focus areas. So a pretty quick way to do that. So this is an example. This is the focus area 4 page. So you can kind of see it. It also uses the same color, so you can coordinate if you if that's how you take in information with the pink. And again, we've got the focus area heading here, and then the next slide, Darcy. You can see activities and worksheets. That's where we've got located any type of downloadable material. Some of those are going to be activities that maybe if you were a manager or a leader that you could implement and do with your team. Again, we tried to be flexible. So you might see in some of these, there are options for, hey, we do our meetings in person, or we do our meetings online, or we do our meetings hybrid. And we tried to account for that when it made sense. And some are worksheets that perhaps people could do on their own or collectively. So we tried to give guidance in those when there was any kind of maybe support needed. We also, because we recognize that sometimes people are new to being a coordinator or a manager or a leader, and having some of that extra kind of just support to do some of these things can be helpful for some folks. And if you don't need it, if you're like, I know how to run this meeting, then you can skip it. Again, that's what was a key part of this, was trying to create some flexibility to account for different experiences and roles and all those different things that affect us in our work. And then down below, you can see we've listed some different resources. So for example, in this section, we have some things around accessibility and disability. We've got resources around supporting the LGBTQ plus communities, thinking about access and communication and translation interpretation, thinking about what can we do to make that stronger overall and not, that goes beyond just the actual translation, but what supports can we build in to make that work better? And then it's at the bottom, it's cut off, but I think another area that when we think about access, we think a lot about trauma-informed practices. How do we create environments where belonging is at the forefront, and that people feel safe and welcome and want to be there and get the support they need? So that's just one snapshot of one of the sections and the type of resources there. We also do have a link on the website too. If you are like, this resource is really great, you should include it. We'll be revamping and revising this, and it's an iterative process. So we're looking forward to hopefully connecting with more people about what supports they use that we maybe didn't include yet. So yeah, there's a lot to unpack on the website. And Darcy, do you want to add anything else before we see what kind of questions folks have?
No, I think we got through it really quickly. So we actually have plenty of time. We try to time out these presentations to be exact, but we've got plenty of time to answer questions if we have them. I'll just keep the presentation off the screen for the moment for the Q&A portion, but then I do have a slide at the end back with that bit.ly link and the QR code so that you can fill out our survey, which is not just like, for your thoughts about the webinar, which absolutely feel free to enter those, but also like ideas that you might have for the future, things you'd like to see us do, other webinars you'd like us to host, etc. So I'll make sure I put that up before we finish out. But yeah, why don't we see if we can take some questions?
Awesome. All right, I'm going to start us off with a question for you, Darcy. And this is from someone who works with volunteers in partnership with healthcare, and talks about the challenges working to overcome the issues that we're talking about here, and that obviously training staff is important, but the question comes: we can only be effective if we take steps up to empower every patient in every interaction. This is particularly true for marginalized communities, especially those living in poverty. Is there any guidance on how to overcome this challenge?
Oh my gosh.
Big question.
Yeah. So whoever wrote that, I mean, this is like, you're doing great work, and I appreciate the question because I think that's probably what the question we all have, right? Is how do we really achieve health equity? How do we make a difference at that systems level? And I also appreciate that you mentioned in your question that like sort of I interpret it anyways that education only goes so far, and that's sort of my mantra too, right? Like teaching workforce development is important. It's one of our focus areas, like teaching your volunteers about structural determinants of health and health equity and barriers that your patients may be facing, and all of that is vitally important for empathy and for action. But what are the actual practical things you can do? So I think it depends. The answer is it depends. I think there's a lot of ideas in this toolkit that maybe at first blush you might say, how is this connected? But it's because it's connected to changing systems. So if I could think of an example, if it's volunteers in a hospital environment, maybe, and something that's consistently identified by the volunteers is issues with food access, right? I'll bring this back up because it was the example I sort of used earlier. Like, I see a lot of people with very good intentions, and it's not a bad thing to do. Provide, oh, we're going to create like a handout with, a list of food resources or food pantries. And that might do something. It might be helpful, but a lot of times people have a lot more transportation. It might be, maybe they don't even read very well and they can't understand the handout, even if you've designed it really to be accessible. Maybe they, There are lots of different reasons, right? So that's why in that circumstance, like I gave an example, like the best example, it would be to use someone like a healthcare or a community health worker. Those are like boots on the ground folks who understand the community and can really serve as like bridges between healthcare and community, and sort of walk people through, right? You don't need to be able to read and comprehend and understand a document. You don't even need to be able to understand how to call or get somewhere if you have those supports in place. Now, it's key that like those resources have to exist. If you don't have a community health worker, then you can't refer to one. If you don't have transportation, that community health worker can't pay for transportation to get someone from point A to point B. But I think this really brings in the systems piece because you might be surprised what you can leverage that exists that other organizations are doing. So while you might not have transportation, there may be, the organization that's providing food might have transportation resources for certain folks. So it takes work, it takes like coordination, and I don't think there's a simple answer, but I think always thinking about how you can work
Mhm.
upstream. How do we fix the system so they don't have to keep encountering the same problem?
Yeah, I would just add same idea that I mean, I literally remember helping refer people to food pantries. We had people who lived in a different zip code than the food pantry where I worked at. So I was having to help them get to another food pantry and explain to them why they can't use the food pantry that's right here. So I see I completely hear the question you're asking. Yeah, and thinking about, okay, well, where are these things that we can break down so that someone doesn't have to go to the food pantry that's far away when there's one right here? Or how can we help them figure out how to use the bus to get to that one until we can figure something else out? Whatever we can do to kind of lessen those burdens for sure. Um, Thank you for asking. We've got some nice compliments. Um, a question about how long did this project take? I know it's very expansive. It's a lot of pieces. It's taken a minute. I don't know if you want to add anything,
Why don't you
Darcy.
say how long you've been working on it, Melanie, and then I'll tell you how long I was working on it before you came into the picture.
I think we've been working with Darcy and the team at CCDPH for about a year and a half in different capacities. I think that's about right. And then, yeah, I don't even how long you've been working on it before that.
I'm trying to pull up the timeline. I want to say that it's really been in development, like not necessarily the specific toolkit, but the framework, the health, all the background work of developing the framework around the health literacy initiative. Um, I want to say it was around August of 2021. So it's been a long time coming. Now, that's not been my only role, and it's certainly not been the only thing that the department's doing as far as like leveraging the resources we have within CCDPH. But that's really when the Health Literacy Initiative was launched. And then the toolkit itself, yeah, I would say really started doing some pre-work before Literacy Works came on. Did some initial work also with the UIC Office of Health Literacy, in like starting to pull together resources and like frameworks that we might want to include. So there was a lot of basis to work on, but then we really started like building the toolkit. It was a little over a year, and that included some pilot testing with community partners, and with some folks that Literacy Works interacts with, um, a commu what's the word?
Our community voices group. Yeah,
Thank you.
we got them involved too. Okay, here's another question, Darcy. What reading level is the health literacy toolkit and resources?
Mm,
Um, can I maybe I can jump in and then you can add on. I think we really just tried to focus less on a specific grade level and focus really on our audience and what they were responding to. I think I mentioned before that the first iteration of the toolkit was denser. And we really wanted to take that to heart. I think it wasn't so much the reading level, it was, I think, the overwhelm of so much information. So you might notice this version, we tried to make it more spacious. We tried to be cognizant of we're introducing terms that we do think are important, making sure we explain them, trying to use a lot of visuals. All of those pieces are pieces that go into, I think, making something more accessible and readable. And then iterating with the folks that we're working with to make sure that it makes sense for them and they understand it. And we also, like I said, Darcy said, we talked to our community voices group that's made up of folks from all different walks of life, as well as the folks that gave feedback are in all different roles. So we had folks that are community health workers, folks that are, in director roles, folks in all sorts of parts of organizations. So I think that was really critical to get all those different lenses, if that makes sense. Darcy, do you want to add anything else to that?
No, yeah, just that like I appreciate the question, and reading level is I feel like that's like the like a buzzword for so many people in health literacy work because it is one of the key and like really early instituted organizational health literacy measures that people have instituted, right? This like for many, 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 many years, people have been saying, let's use something called universal precautions. Let's write everything at a fifth grade or lower reading level so that, as many people can understand it as possible. So I appreciate that as like an example of an organizational health literacy protocol or policy that you could enact. Over time, like Melanie is saying, I think that we've moved away from necessarily using these readability, there are these complicated readability formulas that you use to determine what grade level it reads at. Um, Sort of in favor of more of like user testing approach. I will say our other toolkit that should be coming out, I'm not going to give a timeline because who knows how long it might take, but hopefully within the next year we will have another toolkit which will likely be even more plain language than this one because it's directed more towards um, how to have conversations with folks. This one, while we really want it to be plain language and understandable, um, does deal with some complex content that is a little bit more challenging to adapt. I think like we tried to simplify each component to be clear. And again, I think there's a little bit of a feeling of, hey, if like developing a theory of change, for example, if that doesn't apply to you and that's not part of your work, you can ignore it, you know? You certainly could take the time to learn about it if you'd like to, but it also kind of leaves it open to skip that page, right? Each page doesn't, they stand alone. You don't need to like understand one page to be able to move to the next. So hopefully everybody will find something valuable and relevant to themselves in it.
I think we have maybe time for one more question. We have a couple questions on a similar theme. Just the idea of like, how do we share this with people? So can we share this with parents and guardians? Can we share this with local public health teams in our networks? Can we adapt the things that we come across in your toolkit? Do you want to speak to that, Darcy?
Yeah, share it broadly and widely. When you look at it, you'll see who it may or may not be relevant to. Um, like, can you share it with parents? Sure. I don't know that it would necessarily. I'm trying to think if I've ever used health literacy principles in this way, like in my parenting. Um, I have no qualms about it. And honestly, what would be cool is for me to hear from you guys how you've shared it with different groups and how they have reacted to it or how they might have found things adaptable, right? There's always ways that we
Mm.
could like expand this field into a sort of a different area if we find those like interesting intersections. The real purpose right now of this specific toolkit is for organization, for folks who work at organizations, like they're part of their job, that we are considering part of the public health system, which is quite broad. It could be educational, it could be education, it could be healthcare, it could be, typical, governmental public health, it could be social service agencies. So if you think that you work in public health, then I think you work in public health, and it's for you. Um, And hopefully we'll have, like, again, that web hub will be a place, a repository for future endeavors. So we may have more targeted materials for different audiences in the future. But no qualms about you sharing it. And as far as adapting it, I mean, I guess those regular things apply, right? Don't change it and then put your name on it or something. But 100% you can
You
take
use it.
a page of it and print it a million times and send it to all your friends. And I think we were going to also work on some like some social media graphics that you all could use if you want. We'll put them on the website to promote the toolkit if you'd like to.
Um,
You're right. We are running out of time, so I don't mind taking another question, but what I am gonna do is I'm gonna reshare my screen so I can put up that link and QR code. Oops, that's not what I wanted to push. Okay.
Do you want one last question,
Yeah,
Darcy?
let's do a short one.
Okay, this one's a good one. I mean, they're all good ones. Thank you again for everyone. And if we missed any, we'll make sure we address those. But this one is about getting leadership, not just to buy in, but excitement and thinking about measurement and stories and data, and basically like how do you get leader, if I'm understanding this question right, how do you get leadership to really engage with these ideas of change when change is hard? And maybe how do we connect it to health outcomes? It's a
Oh,
lot to
oh,
ask,
okay.
so
I
we might
got
not have
two
time. You might
two
need to think
minutes.
about it.
Okay. Okay. I love this though. And I want to, whoever's putting these questions in, like reach out to me. Let's talk because I love to talk about this stuff. So I'll just really briefly say leadership buy-in. Again, if we're talking about sort of that top-down hierarchical type of leadership, because we can all be leaders, but if we're looking at like, oh, how do I get the CEO of my organization or the CMO or the COO to buy in? It's really going to depend on that person. CCDPH is super lucky to have an executive team who is very supportive of health literacy work and really believes in it. And again, centers our work around health equity. So hasn't been a difficult lift here. That might not be true in your organization. Um, I could talk a lot about how you can position, like think about powerful relationships that you have. Who do you know who knows someone who could influence if you're not the one who can directly influence, right? There's a lot of ways we can think about influencing thought at these like high levels. Um, Also, I think, being an advocate yourself. I think your voice sometimes matters more than people think that they do. Um, the evaluation, I don't even want to go in there because it's such a huge thing, but I am very interested, and I hope that I'll be able to do this sometime in my career, but it's a big endeavor in thinking about how, we have measures of health literacy, but those measures are really for individual health literacy. So if anybody knows about how we like assess health literacy, it's really based on like testing people, right? That doesn't tell us anything about the systems that are supporting them, right? Someone could have amazing health literacy because they have a family who provides all of their support for them and they really are fully supported and able to make all their health decisions, even though potentially they, have very low literacy skills or other things that you might traditionally tie to having like low personal health literacy. So I'm really interested in looking at how we measure health literacy of communities. There's a really interesting paper. I wish I could remember the authors off the top of my head who modeled what it looks like to do a community health literacy assessment. So that's similar to our really public health folks on here who know about a CHA or a CHIP. That's a community health assessment, community health improvement plan. These authors had developed a community health literacy assessment, which is something I'd be super interested in implementing, but obviously that's a big lift. And measuring outcomes for things like health literacy and health equity in general is a huge challenge. We don't have time to get into it right now, but a good question. And I'm so excited for these good questions. Please keep in touch with us. If you haven't yet, just go. Maybe we could keep this meeting link open for another minute or two so you can get on that QR code or put in that bit.ly link. Um, let's see what else I just wanted to say. Thank you all for being here. If you want to stay engaged with us, there's a way to do so by going through that link. I really hope you guys all find these resources useful and valuable. Thanks to Melanie Sampson and Literacy Works for joining us and helping us with planning all of this. And I hope you guys all have a really good day.